of you has any issue, please just disconnect the image, okay? So, can I proceed? Willeke, it is already being recorded, right? Yeah. Okay, first, thank you so much, all of you, for being here. Thank you also for our speakers. As you know, we have been doing, as I was saying, a series of webinars. Mainly the major objective is to bring issues that are important for our cost action. And one of them is, of course, how to build and nurture a regional or national ecosystem, because we all understand that in order to have more holistic approaches, we need to work together and work with as many organizations as possible. So we have asked the ECHAlliance to help us organizing this session. So this is a good partnering for today, because of course this is what they do. So we will start with having Brian giving us a first inspirational talk about what is an ecosystem and how to build it. And we will then have two ecosystems presenting their stories. It is Digital Health Rhineland and Cluster Saúde de Galicia. Sorry, because I think someone is talking in the background. If you can please mute. Thank you. Then we will have Valentina Tageo from ECHAlliance as well, discussing a little bit what can be the enablers and challenges to implement and scale up solutions within the ecosystems. This is a part of the Digital Health Europe project, and the idea will be here to foster a lot of discussion. So we will have inspiration, then examples, and then shall we all discuss what we can do in our regions, what we need still to improve, and from here, well, I think we have a lot to talk about. So if you all agree, I will now pass the floor to Brian. And again, I would please ask you to mute the microphones, because we can still hear some people. And Brian, the floor is yours. Please feel free.
Thanks very much, Carina. Delighted to be here. It's a bit of a challenge to be told I'm supposed to be inspirational at this time of the morning. I'm much more inspirational in the evening, but let's try anyway. First of all, it is a pleasure to be here. And as you say, we have been building and creating ecosystems now for well over 10 years. I have to say we've learned a lot during that time. We had some mistakes during that time. And as many of the people in the audience with us today will know, because many have come on the journey with us, including Alexia and Gisela and many others. It's one of those learning experiences which there are times I thought, is this ever going to work? The reality is it has worked and is working, and we need to do more of it, because we've now moved to the stage where we have about 65 of these ecosystems. And I remember when I first started this, I was told not to use the word ecosystem, because it's normally applied to nature, the combination of many plants and fauna and so on in nature. But what we realized very soon afterwards, we're no different. What this is about is being connected, is running our definition of ecosystems. We had to make our own definition, because everyone has a different view of what it means. What it means to us is this: you have to create ecosystems which are permanent. That word is really important to us, because one-off events are lovely, but how effective are they? They need to be a series of things. So we decided we wanted to have permanent ecosystems which meet 3 or 4 times a year in their own region or country. And that creates relationships, creates knowledge, creates trust, respect, and eventually creates collaboration. And that's been our experiences over those 10 years. The second thing is that I hate silos. I just hate them. The problem is some of the silos in the world are really very big. Whole health systems running a country are enormous by their nature. The problem is they're so big that people who work in them sometimes think they are the world, whereas in fact they are a silo in a much bigger world. So part of our original thought was to try to break down silos. These words are useful, but there's no point to them unless you actually provide a methodology to actually break down the silos. So what we started to do, we started by inviting silos into the same room. I remember many years ago, we started in Manchester, England, as one of our first meetings. And everyone was amazed because in the room we had universities, we had hospital groups, doctors, nurses, community nurses, industry. At that time, we didn't have any patient groups that we have now. And I was amazed at how few people knew each other. And that is when I realized that we were onto something about simply creating a methodology, a meeting place, these days virtual often, but nevertheless a meeting place where people knew they could meet people from other silos. So you don't start by breaking down the silo, you start by connecting the silos, and eventually they break down. So we really went out to get as many different actors in our complex health and care sector to get to know each other. Because by and large, you do business with people you know. You do business with people you begin to trust and respect. And when I say business, remember, business can mean not just from an industry perspective, but universities are always looking for partners to do European projects with. Hospitals are looking for the latest innovation. Companies are always looking for more business, but often looking, for example, for pilots, though I hate that word as well, or these first phase innovation trials, as we like to call them. So those were the first two: permanent, multi-stakeholder communities. And the word community is really, really important. This is not about any one organization within an ecosystem, dominating the ecosystem. It's about bringing a number of those actors together in a region or a country and getting them to say, can we work together? If we can, we should attract more of our local community to join us, knowing that they exist. Remember years ago when, if you all remember, the EIP, when we had reference sites. I remember being in Liverpool, England once when I asked the local reference site to speak at the Liverpool ecosystem. I would think 99% of the people in that room had never heard of a reference site, didn't know what it did, but were delighted to meet the reference site and what they were doing. So again, we connected dots and are still doing that with many reference sites across Europe. The community therefore builds and builds. And then what you've got to do is you say, okay, we've now developed these across all of these countries. We now have a better intelligence about what is needed in each of those communities than most other people have. So it became an intelligence network as well as a community network. And why does that matter? It matters because at a meeting we had recently of our ecosystem coordinators run by Andy Bleeden, our ecosystem director, we were able to listen, not just talk, able to listen to what the needs of those ecosystems were. It's fascinating, you know, sometimes when you give people the opportunity to tell you what they need, as opposed to others telling them what they should need. There are too many solutions chasing after needs that don't exist. So what we have tried to do is to listen, to take best practice, successes, and by the way, failures from one part of our ecosystem network to another. And the point of that was to attempt to begin the process, and it's a long process, and it's a long way from finished, but to try to literally connect people to people to people. And I look around the people who are attending this, and I look at, you know, Gisela there, and I look at the trade missions that you have run from your country to other countries to other ecosystems. I look at the connections you and others have made through Alexia and others on this call, where there is a specific need in a particular region, and somebody puts their hands up and says, oh, by the way, you know, I've got the same need, or I tried that, please don't do that. It doesn't work. Because failures are important as well. So you have to be able to disseminate, and that's one of the things the Alliance does and will continue doing, to disseminate best practice, successes, failures, and above all, the connection of the dots. Excuse me for calling everyone a dot, but if you use that expression, it is really important for people to know each other, because then you know what you're doing. You know what solution you're already using. You know what to avoid. And above all, maybe I'll finish by saying this. Through that network, we have now created, as you all know, many of you are very involved in these projects with us. We've now created a project team who can look at the ecosystem network and say, you know, though that lady, that person over there, that ecosystem would be a brilliant partner for the next call from the Commission. But you do that on the basis of existing knowledge, not looking down a list and wondering who you might know in a particular country. You already know people in each of these countries. You already know people in each of the categories in each of those countries. So this is genuinely about open, transparent collaboration. It's about giving everyone an opportunity to make a decision. Do you want to work with anyone else? I have met no one so far who says collaboration is a bad idea. Clearly, you need a methodology to make it work. It's not enough to say, I'd love to collaborate. You got to say, well, what does that mean? Where do I go? Who do I talk to? And that's where what we have learned over the last 10 years of the Alliance. And I know, looking at the list, how many people are already members of ours and have joined us in our ecosystems. And we look forward to continuing to expand that network to help each region, each country learn from each other. So I don't know whether that was inspirational or not, Carina, but it is our history and what we will continue to do in the future. It's great to see so many friends on the call. Thanks very much for listening.
Thank you, Brian. I'm sure it was very inspirational, and it will also raise a number of questions from our colleagues for sure. Thank you so much for this. So we now had this first overview, and we want to go to practice as well. And as Brian was saying, we have here two speakers, Alexia and Gisela. Thank you so much for joining us. They will be presenting their own experiences in their own ecosystems and sharing a little bit with us of what went well, what went wrong, and what can you take home from this experience. Starting to move forward, Alexia, would you share the screen and start over? Thank you.
With pleasure, and thank you very much for having me this morning. And I can only say, I mean, Brian, first of all, it's a pleasure seeing you. But if you say, you know, you're not inspirational at 9 your time in the morning, well, it's kind of hard to come after Brian O'Connor, you know. Thanks very much for all the words, and I think we all quite like being the dots of the ECHAlliance family. I think it's a nice feeling, and it's also obviously lots of positives, and I guess that's what I would like to talk to you about today. So I'm Alexia, and I represent a so-called health region, Cologne Bonn. We are also a EAP on AHA reference site as a health region, Cologne Bonn, but we also the ecosystem Digital Health Rhineland. And so I will tell you a little bit more about how we function and how that all came along, and what we are today and what we're doing and where we see ourselves. It allowed me, actually, the invitation expressed by Carina for today's workshop allowed me to also have like an own look on our work and reflect a little on, you know, well, why does it work and what doesn't work, and what is fun about it, and so on. So yes, it was greatly appreciated. Thank you. So who are we? Well, so the health region Cologne Bonn is a geographical region, but it's way more than just as the name says, Cologne and Bonn. You have seen it on the map on the first slide, and I will go back to that. But we are roughly 140 members, and they come from a whole range of sectors, and that's all the logos. But they do, as I said, they come from consultancy, they come from health prevention, they come from research and university, academia environments. That's the third pillar here. They also come directly from healthcare provider institutions. They're also public bodies, and we'll come back to that in a minute. Sector-wise, there's obviously a lot of medtech and health digitalization, pharma, biotech, insurances, and some more others, service providers all around health. So it's health, but it's more than just healthcare provision. It's more than just healthcare research. It's everything. And as I said, one of the maybe particularities as opposed to other European health regions or clusters or ecosystems that I have met before, is that the founding members, some of them actually from the health region, are the public bodies, are the cities of Bonn, Cologne, Leverkusen, and the regional districts. What is interesting is that, and that might be particular to the situation in Germany, is that the regional districts actually have quite a strong role in the provision of health and care services. So obviously it's of great advantage both to them to be within a network where we offer them the opportunities to collaborate, discuss, inform themselves. But also it's obviously great for us because they are the decision makers at their level, and they are responsible. For example, at the moment, they are the ones responsible for setting up the vaccination centers. They are responsible for the statistics and so on and so forth. So it's a great source of information, but there's also a need, and so that's why I love Brian so much, because that approach of the need-oriented approach is obviously at the heart also of our ecosystem. Oh, that was a bit fast. I already mentioned the medical technology firms. What we did a couple of years ago was to offer them the opportunity to present themselves in an ebook that was going abroad. So basically, it was also something that is interesting for a regional ecosystem, is to show the strength and the capacities and the knowledge and the assets of the region. So this is something that was done together with the Chambers of Commerces of Bonn and Cologne. And that was then distributed to the International Chamber of Commerce, and that was presenting, showcasing all that the knowledge and the expertise that we have here in the region. But it is also and I guess that is mainly, it's almost my favorite part of the job, is that we are a network of networks, and that those networks that are both they can be local. That's the core net that you see here, which is representing the dome, sorry for that, and which is also very much patient oriented, and it's a very translational work in that they put research networks or research results and research projects together with the reality of the provision of healthcare at the local level. So that's why we are both part of that, but support that equally. And then we've got national networks, like the network of the German health regions, which is super important because that works at the policy level in Berlin. And then there's transnational, transregional networks such as Coral, the international global networks such as the ECHAlliance, and then there's the programs like EAP on AHA and other types of programs. And I guess that is really where we see the added value of being part of that, is because what might seem redundant, and I guess it's also a part of what Brian just said about that, they live in the same city and they don't know about the other network, like the Liverpool ecosystem didn't know the Liverpool reference site. I'm not surprised. It would probably be this. I mean, that's the type of that of experiences that we have as well, and so I never get tired of connecting with the others, and I'm going to come to the point of also why. But even if it's overlapping sometimes, like as you were saying, there's a lot of ecosystems from the ECHAlliance that are also reference sites, but yet it's a different approach, it's a different type of working together, and the more opportunities we have to work with each other, the more we learn from each other. And yes, we are, since 2018, we are ECHAlliance ecosystem together. So we are the spokesperson for the ecosystem, but it's a collaborative effort with the Chamber of Commerce of Cologne, an organization called Digital Health Citizen, and the Digital Hub Cologne. And how are we organized? So this it might be interesting for only a very few of us here on the webinar, but I'm still going to go on to that next slide, because it's something that might be very typically German, the way we are structured, but for us it's been working. And what I haven't mentioned so far is that the ecosystem exists since 2018, but we've been around for over 12 years now, and it's a bottom-up approach, which we're very proud of. So it's really all those members and the founding fathers and the public bodies and the private sector that and the academia that I've presented so far, that came together and expressed the will to network and to work together. And so that's something that's at the heart of our philosophy. And the way we organize, the way we have our governance, is we are a 3-pillar organization. We have that members association, which is the part that I presented so far. But that members association realized that in order actually to be needs oriented, it couldn't wait for the once a year members general assembly, the GA that is there, in order to exchange ideas. It needed to be much more reactive and even proactive in order to work together closely with our members, go with them for funding opportunities, design projects, and accompany them when they go to talk to different types of funders. Let it be at the local, regional, national, European level. So the Members Association, as I said, was established about 12 years ago, and then 7 years ago, it created its own company, which is like 100% company affiliated to the Members Association. And I'm the head of that. But it's also relying very closely on the close coordination with the Gevi Institute for Healthcare Studies. So that's why we say we are a 3-pillar organization. We have the association bit, the company bit, which is very much project and need oriented, and the institute, which will also be coming into play when it's about studies of, or studies which are, well, yeah, obviously healthcare studies, as the name says it, but trying to see what, how to bring an innovation onto the market. Having Delphi studies or whatever, so we have that opportunity for them that they can use, and also that the institute is part of other projects at the regional or European level. We are part of a huge Horizon 2020 project at the time, so there's a lot of knowledge there. And I guess the other thing that we do as an ecosystem, and as Brian was also saying, we offer lots of events, and what we always want, like our sacred goal is to be at the top of what is being said at the moment. So because we have within our members, we have the university hospitals, Cologne and Bonn, that are top of their league in terms of research, and so on and so forth. So we build on that in order to have conferences that are not repeating things that have been said 100 times over, but that might be, we always try to be a little bit ahead of our times. Same with the workshops and the webinars. We've got regular meetings in working groups that are organized topic-wise, but we also have fireside chats, that format, which is a little bit more exclusive with very high-level, top-rank politicians and so on and so forth. We've got summer birds, which are more informal and for the members to get to know each other, and of course also lots of online meetups, on-site events with our companies, and after-work meetings. I mean, we're in Cologne after all, so there's lots of breweries to go and visit and chit chat, and we always have like topic related talks at those afterworks meetings as well. So what are the main assets working for an ecosystem? Well, as I said, we always in touch with our members, and the themes that are collected here are the ones expressed by them, and so we clustered them into the topics of integrated care, healthy aging, digital health, of course, with all what it entails, artificial intelligence, and so on and so forth, and prevention. And we also have been organizing for the fifth consecutive time, actually sixth, it will be the sixth consecutive time this year. We've been organizing the Cologne Bonn Week for mental health. So every 2 years, that is it's a huge open platform of events around mental health, and it's always taking place in October around Mental Health Day. So that, as I said, it's always involving the membership. And competencies, well, competencies lead to project. So I did already mention SHAFE, which is that Horizon 2020 project, which is very close to the aims of the age-friendly, net age-friendly project as well. It's all about creating an ecosystem, enabling large-scale deployment of digital solutions for healthy and independent lives. And we're very proud to be part of that. It's led by the University of Maynooth. We've got at the national level one of those innovation funds projects that is typical to the German funding environment. And Brian, you will see also that the way we work here is, when I saw that we are not consortium lead on that one, it's the district itself, and they came up with that graph, and I couldn't help thinking, well, have they actually looked at the ecosystem graph? But obviously, that it's also that very patient-centered approach that is at the heart of the project. It's an integrated care project involving the introduction of a data health platform. And we've got a third project here, which is building, which is also also belongs to healthy aging, which is why I selected it, and which is building upon digitalization of data and machine learning in order to be able to be more on the predicting side of things. What do we recommend? Well, that was a tricky question, Carina, that you asked me to fulfill here, because it's always hard. I mean, what works for me might not work for someone else, but I guess what's been working for us, at least, is that, as I said, we work in a bottom-up fashion. We very cherish a transdisciplinary approach, and co-design is at the heart of a lot of projects that we are involved in. We work collaboratively. Our pilots are patient-oriented, and the thematic networking has been working for us a lot. So through the different networks, that's on different topics. The example also would be the Chorale network, where AAL is the issue. So you get the regional partners from other countries there. The thematic partnerships that the ECHAlliance is setting up at the moment are, I guess, the best idea. Because that's exactly, you will have the excellence of those regions within the networks, and you will have those topics presented prominently, and we're very proud to be part of that. And obviously the regional partnering, and I should have added the cross-regional partnering is also a success that we can at least report on. So I hope that wasn't too long. I'd completely lost track of time. Thank you very much for giving me the opportunity to present our doing. And I can't wait to listen to Gisela. Thank you.
Thank you, Alexia. It was very interesting, so I'm sure it was not too much time. So I would pass the floor then to Gisela. She will be presenting the cluster Saúde de Galicia. If you can share your screen exactly and unmute. Thank you so much. Thank you, Alexia, and looking forward to listening to you, Gisela.
Thank you. Oops. I don't seem to be able to put it on presentation mode. Yeah, that should be okay. Sorry. Okay, so thanks a lot for the invitation. If Alexia thought it was difficult after Brian, imagine Brian, Alexia, and then me. But I think it's a good mixture, and it's a good example that an Irish, a German, and then a Spanish can collaborate together. So I hope I get the message through. So I always try to talk from a region base to kind of present our ecosystem, which we of course coordinate for ECHAlliance, but is built up with a lot of stakeholders that really follow this scheme that always is ECHAlliance show. We are the typical ecosystem with all the different stakeholders that is required, so to say, to classify. But I just wanted to pinpoint that Galicia is a region of opportunities, not only in healthcare, but also in social care, because we're moving quite a lot in that direction, joining both sectors as with the people in the center. So I don't know, I guess at the European level, it's more common to know that Spain is organized by regions where they have independent funding and in regulatory wise for healthcare and social care systems. We are not a very high population. We are only 2.7 million, depends who you compare with. But we have the particularity that I will include myself, we are very aged. So we are an aging population, even more than Japan. We have a higher, the highest life expectancy. And we are also very dispersed. So that also creates a lot of pushing forward for digitalization. So, and the Galician health system has been particularly active on that since 2010. High investment in healthcare, as I assume many regions in this world, and more nowadays. We are especially highlighting the fact that we carry on the 40% of the public procurement of innovation in Spain. So that is carried on in Galicia. And that actually is outdated because today they came at news that instead of 150 million, we have already moved to 250 million for the last 4 years. So it's not bad. We have more than 5,000 foreign companies, despite we're like a small region, but it's a good region to connect with UK and also the Latin American sector. A lot of hospitals and healthcare centers, private care homes, of course, pharmacy, but we are integrated in 7 managed structures that make it even more efficient, I would say, the organization. So we are not a very big market-wise, but at least they try to get the strategy that you need money to do things. So the Galician health system has been very active in really putting together, aligning together what we want to do in innovation, and especially involving digitalization and integration, interoperability of our systems, together align it with, first of all, European strategy, and also that means funding as well. So as you can see, since 2012 till nowadays, we have a lot of public procurement of innovation programs, different European projects. We are also reference sites of 4 stars. You know, so on and so forth, different prices, and well, that's always very good, and always keeping it active. It's good to keep putting things. So what is the Galician Health Cluster? What's its evolution? So the Galician Health Cluster was established in 2011, and it was actually potentiated by the public side. We were called the cluster of the regional ministry, but it was really an idea that the public administration wanted to know their ecosystem. They wanted to know the ecosystem of the private companies, where the funding should be really dedicated, if we have the potential, if we need to introduce other type of companies, who do we have to help, what kind of SMEs, because we're majorly SMEs, do we have, and how to align them in order to really make them collaborate and work together. So the evolution has been, I would say, break into 2 parts, 2011 to 2016. It was very public oriented. Only big companies really understood this idea of gathering, association, collaboration. But in 2016, they decided to put a structure into the cluster, like their own structure, their own team, which is me. Not because, not only because of me that there was this change, but I think when you put people, as Alexia was mentioning, a team that responds to the needs, the change is there. So from 2016 to 2020, the cluster changed of strategy, and we had 2 main strategies. One was to really improve this communication between the regulators, the industry, and the users. We do have all these type of stakeholders in the cluster, so we do have a collaboration and agreements with the regulators. We do have, of course, a lot of variable industries, research centers, knowledge centers, universities, but we do have the patients association and the professionals. So former caregiver associations. We do have them inside the cluster. From then on, the other strategy was internationalization, because we thought in order to innovate, you really cannot innovate only in a single region without looking into outside. So we really started our regional, national, international collaboration. And also because there's this, I would say, human trait that when you go out, you really feel more your region and you actually get together with other Galicians. So this really worked very well. We got involved in B2B projects, our companies, but especially European projects, and we got more visibility altogether. Not only us, but also our companies. We are active from 9 years. Our birthday is in September, so we'll turn 10, but I'm hoping to be in a better post-COVID situation. So that's why I still keep the 9 until September, hoping to make a party somehow. We do really cover 4 sectors, but this has been kind of outdated. We're in a very interesting moment for our clusters because we are doing a lot of changes. Before, we divided our chain values in healthcare, food tech, health tech, and support. So all the finances, insurance, and tech scouting, etc. But now, how our projects are moving and how the cluster and the ecosystem is moving with it, is that we really are strong in healthcare. So we do have a lot of competencies in healthcare, social care. Then it will be an intermediate one that we call the change of model of care, which is a mixture in Spanish is sociosanitario, so it's health, social care, because we really want to join this together, as I mentioned, putting the person in the center. Then we do really have a digital transformation involved in that. Not only COVID has shown us that, but healthcare system was really digitalized here in Galicia, but not so much the social part, and now these two are getting together. We have more than 90 members now, because well, we move a lot of people and a lot of money around. Our members that I put by alphabetical order, but it's really a mixture of, as I mentioned, big companies, multinational companies, SMEs, patient associations, universities, research centers, governmental agencies of innovation, etc. I mean, small entrepreneurs, startups, and in all of these areas that englobe healthcare and social care, so quite broad, architect, engineering, etc. And we consider with a lot of care our partners. So in our logo, in fact, is accompanied by our partners. So we feel very proud and we think that if you're a partner of an association, you have to be active in it. If not, I mean, there's no point of putting a logo there. So we are extremely active in ECHAlliance. We are very business oriented, so we try to do very actionable collaborations, whether it's within our network or companies or different professional associations. And so we do prepare with them the learning expeditions. So we have worked with ECHAlliance in these study trips that we call, and it's a very nice experience because we all go together as a consortium and we really stick together, and it's not so much company by company looking for a meeting, but rather a consortium presenting several projects in collaboration and wanting to collaborate with the other markets. So we met the friends now that we have here when we went to Holland, Willeke. So it was an extraordinary trip pre-COVID, so we still have it very strong in our memories. So we do collaborate in other things, but especially in our most important event, which is our ecosystem meeting for visibility of innovation solutions, which is our RIES that I will explain later. It's a forum that we do every year, and ECHAlliance has accompanied us from the beginning. Then we also collaborate with TEAM, which is another network of clusters, life science cluster, spread out around the world, not as big as ECHAlliance, but in fact with the same philosophy of collaboration. And we are also bridging the collaboration that TEAM and ECHAlliance have now. So we are very happy that we are collaborating in particular actions. And then we are funders of the Digital Innovation Hub Data Life that really takes in consideration primary resources and healthcare and social care in our region. So as I mentioned, for us, the internationalization strategy is how it has worked for us. Having, I would say, two sides. One side will be like the internal funding. So our regional government also funds international activities that we have, and even provides with personnel as well, human resources, and well, different actions of training, learning expeditions, different market studies, etc. So this is the one we have done with ECHAlliance. We've been in Slovenia, Serbia, Holland, so it has been really, really nice. And this 3 Years Forum is also this big event I was mentioning that now has become into a program in which we invite, we pick, well, the whole ecosystem picks a trend topic that they're interested in, and we do several activities around this topic, and we do a big summary event, usually in October, November, where we have exchange of good practices, cases, study cases, investment, pitch, etc., with international speakers. And of course, our friends from ECHAlliance are always invited as partners into this. And then we do also have started joining the Horizon 2020, Horizon Europe now, but also other Interreg programs, so European programs, to really be able to keep supporting innovation in our ecosystem. So we have finished 2 projects, ITAN Europe, Interreg Europe, which was an exchange of good practice in the healthcare systems, Código Mais, which was Interreg POCTEC to establish an innovation ecosystem between Galicia and north of Portugal. We have a lot of connection there. And now the ones that we have active actually are Neuro-Atlantic and Infor-AHA. So Neuro-Atlantic is, our role there is really to not only dissemination and communication, but also capitalization of research results regarding early prediction of Alzheimer and stroke. And in Infor-AHA, we have a more predominant role. We are getting more and more involved, and we are leading the work package where we validate technological solutions for healthy and active aging in the Living Lab. So we have 2 settings. We have a setting in the Living Lab of Finland, and a Living Lab, our social care Living Labs in Galicia with our users. So there's only 1 day left, but don't worry, because we're going to extend a little bit. But I wanted to explain the call. We have an open call for getting innovations, tech-based or digital-based oriented for an active, healthy aging and for senior citizens, but also informal and informal caregivers of these senior citizens. And it's open till tomorrow, but tomorrow we will inform that it's open for 2 more weeks. So I hope to receive more and more. I was telling the consortium to relax, not to worry, because Spanish now they were updating and they were coming in the proposals, but we always will till the end. So I think that Infor-AHA has actually solidified a new part of the cluster that I would like to share with all of you, because I think it's important to see how we can collaborate. And one point of collaboration is this person-centered care Living Lab ecosystem that we have in the clusters of the Galicia. So we have quite a bunch of different type of entities, more spas, daycare centers, bigger, smaller type of care homes, different type of users. And so they are all established now with a homogeneous way of testing solutions for senior citizens. And we are piloting this type of consortium and ecosystem. We're piloting and within Infor-AHA. So we have, of course, I would say the typical services from Living Labs, co-creation and design, evaluation and validation. But I think the training one, I would highlight it, because in these Living Labs, they have a very, very strong interest in training the professional, but also so the formal, and the informal caregivers, which the families get involved. So it's very good. So why become a member? I have to answer to this question almost every day. So I think we bring a lot of visibility. For us, we don't like to actually call ourselves a lobby. We would like to become a reference consulted entity for our government, so another government, so that would be our achievement. We like to consider a lighthouse to be a reference where the trends are going, but also a point of reference to see where the interest in investment is. We, of course, networking and collaboration, and as Alexa mentioned, is the key point. We do a lot of activities translating into that. Knowledge, so training is very, very important, keep up to date, and of course, projects. We have not only international projects, but also internal projects. And also one thing that we are proud of is that we are trying to really reinvest in our own region. So all the public social, corporate social responsibility of our big companies, we are trying to really move it to help our patient associations and small companies. So sorry, but I couldn't look at the watch at the same time. So I hope I was in time.
Yes, thank you so much, Gisela. I think it was very nice, and I'm sure that there will be a lot of questions afterwards for both for you and Alexia, for sure. Valentina, this would now go back to you. Well, we have been discussing the examples, and now let's discuss a little bit what are the challenges and what we can do to overcome them. The floor is yours. Thank you.
Thank you, Carina. Thanks a lot to the Net4Age team to invite me today. Can you hear me well? Yeah, one.
Yeah.
So let me share the screen. What I can anticipate while trying to put it in a full screen mode is that I'm basically going to have this tricky role of debate stimulator, but I think that there will be already a lot of questions related to the tangible example that we have listened so far. And to try to accomplish my task today, I'm going to use basically very few slides to present you the results of one of the activities that we at the ECHAlliance team have carried out in the frame of the H2020 project Digital Health Europe, which started in 2019, and it's ending this year in September. Digital Health Europe is a coordination and support action. Very shortly, just to tell you that it's a very large consortium with many of the key networks and stakeholders operating in the field of digital health represented. And what we have tried to do in the last few years was putting in place a series of action to boost innovation and advance the digital single market priorities that the European Commission settled in their 2018 communication on the digital transformation of health and care. So there were basically three main priorities in this communication, and one of those was mostly focusing on digital tools for empowerment, for citizens' empowerment, for person-centered care. So in the specific frame of one of the work packages of this project, we focused our attention on what is needed to support large-scale deployment. And of course, the work that is being done inside and across all these ecosystems that you are listening about today is fundamental. And it was also very important for us to conduct a more in-depth analysis of what are the barriers and the enablers that are influencing the implementation at scale of digital person-centered care solution, health and social care, both on the demand and also on the supply side, with the final aim to try to configure a set of recommendations to overcome those hurdles and help mobilize investments in the sector. So based on this analysis, we have released a set of recommendations. This brochure that you can see in the screen is a good summary actually of the work that has been conducted. The link is there for your consultation afterwards. And the methodology followed was consisted basically of an extensive review of available evidence and documentation around existing good practice and initiatives, but also interviews and an in-depth survey with stakeholders from 14 countries across Europe. And this led us to the opportunity to cluster a number of challenges and on the other end also a number of enablers. I think it's important to acknowledge that there are several complementary and sometimes also overlapping studies today. Maybe we know much more now than 10 years ago when, as Brian was suggesting before. And this is really a landscape that is rapidly evolving. So ideally, this type of analysis should be conducted on a kind of recurrent basis, because we will need to grasp any new elements, such as the ones that the pandemic has put now very manifest and evident. But nevertheless, we found out particular elements that stakeholders felt more important, more relevant. And we've understood that even though some of these barriers that you can see in the screen are very well known probably, and we have identified them, now we know that we have to cope with them. Understanding barriers is really important in this sector, because they are, of course, they are lowering adoption of the innovations at scale, and this is hindering the capacity of the innovation to produce some socially desirable outcome. But they are also generating suboptimal investments in this field. And it's particularly true that digital health is not only promising on the societal level, but it's a key business area that can be a big generator of job creation and economic growth. So just mentioning a few, because I really would like to hear from you in the discussion afterwards. The diversity of health and care systems and regulation was one of the top priority challenges named by the stakeholders. Still, the uneven levels of literacy and digital skills is an issue that is on the top of our concerns. Difficulties in requiring and obtaining certification which are not, let's say, sustained by agile mechanisms, etc. And on the other side, we did the same with enablers. So we asked our stakeholders to tell us what could work to increase resilience of health systems, to really foster the adoption of the solutions that are there, because technologies are really mature today, but they are still struggling to take the most advantage from them. Naming few of them, I would say that they felt that there is an increased awareness and knowledge among professionals. Also, health providers are getting more and more experienced, maybe also thanks to the many pilots that we do hope will turn soon and fast in larger scale adoption. They are learning about how to gather more reliable evidence, which is still a challenge in many cases. Many multi-stakeholder engagement frameworks have been developed, and the collaboration at national, cross-regional and international level, as you saw from the example of our ecosystems, is representing a big advantage to progress in this field. Based on the analysis of both the challenges and the enablers that we selected, we were able to pack together a list of recommendations. They are framed along the 4 key areas, which you can see in front of your screen. Recommendation related to the legal framework, governance and strategy. Basically, here we clustered all those recommendations that would like to ask the European Union and the member state to leverage those existing networks that they have established in these years for more harmonized policies. Reforms, of course, need longer term planning, sometimes very often longer than electoral cycles, and this is something very important. This recommendation includes also a lot of reference to adoption of standards and harmonized regulation, the promotion of the adoption of electronic health records when this is still not the case, and its cross-border exchanges. But in the other areas, what we emphasize is that political action is of course fundamental. It's not the only key elements. We have also recommendation clustered around the lines of innovation management and procurement, trying to shift the attention also not only to efficient procedures for procurement and innovation management, but also the integration of capacity building and the human element inside the use of those instruments. Thirdly, the funding and investment side. As I said, mobilizing investment is one of the critical area, and one of the things that this group of recommendation mention is, for instance, the more efficient reorganization of national regional reimbursement schemes. And lastly, the important fourth group of recommendation, more oriented to bridge organizational and professional boundaries. So here we are targeting more model to assess long-term impact and understanding what are all the skills missing in the landscape to bridge these gaps. I won't have the time to go through all the recommendations that are in those four groups, but what we thought could be interesting maybe could be to make a start, just to trigger a bit the discussion and make it more lively, and use our two testimonials from the German and the Spanish ecosystems to discuss some examples. So these are a couple of recommendations that you will find in the brochure. And I will try to start a bit the conversation together with Alexia and Gisela, and then open the floor also, thanks to the help of Carina, to the rest of attendees. So let's start first from funding and investment as an example. We have selected specifically a recommendation related to the implementation of midterm strategies and funding programs for digital infrastructure. And I wanted to call the attention of Alexia specifically on this point, because of course we have observed a lot of progresses in specific healthcare organizations that are progressing a lot, and they are becoming champions in their own innovation path, let's say. But it's really important to us also to frame very well this recommendation towards the community, because it's pretty needed a broader, in our opinion at least, a broader approach to digital infrastructure that is not only targeting health services, but also social care, community services, to avoid that in the end we have separate islands, let's say, that are still complicating the landscape and not taking full advantage of the use and reuse of data, for instance. So Alexia, I would just ask you if you want first to comment or tell us if you feel this is in line with the work done so far in the Cologne Bonn ecosystems, and how the region is addressing this issue.
Well, thanks very much, Valentina, and great to see you too. And thank you for addressing that question to me. Indeed, and again, I do speak with the, coming from where I am based, coming from Germany, and I was deeply jealous when Gisela was saying, well, we kind of digitalized the health part, but what we were lacking was the social part. Well, Germany is lacking just everything. Germans just love paper, pens, and stamps, especially stamps. That's actually my theory, is that's why they're not digitalizing, because the action of stamping a piece of paper, you just can't replace that. And I guess that once we will have overcome that stamping issue that is just very, very, dear to Germans, we might actually move a step forward towards digitalization. But joke aside, there's issues, and all the issues that you have listed here, namely not only bridging the social and the care sectors, but also the infrastructure problem Germany has. And it might not be evident, because the first thing that comes to mind is obviously it might be Berlin or Frankfurt or Cologne, but there's very wide areas of rural regions with very scarce population, and obviously it's the eldest part of the population that is living there. So there is that issue of also poor infrastructure in terms of no coverage, and I'm speaking not in the middle of nowhere. I'm speaking literally 45 minutes outside of Cologne, where in order to use your mobile phone you have to go on the top of the hill of your garden, because within your house you don't have enough coverage, you don't have network. So I guess that obviously, you know, it's nothing that is unknown to neither the national funders or governments or regional authorities. And yes, it is being addressed, but that is something where that strategy and funding program, because obviously everyone goes where the money is might be key. And in order, and it is key when it is not siloed. It is key when it is not, okay, now we do something on infrastructure, but we completely forget to include service providers, or now we do something on interoperability, you know, and we have that new criteria or exigence that health systems and care, I mean, data, health information systems and care information systems have to. So I guess that one of the biggest earnings would be of an overarching strategy in order to address that as an overall problem, including all the stakeholders and actors. And this is something that we've all been saying for years and years and years, right? And yet somehow there's still that last tip is missing in order to make that work, and in order to make that decisive change for a truly data-based integrated care for the patients. So that's why it's an issue that's really dear to me, and where that would greatly benefit from an overarching strategy, and probably from that EU label, and maybe EU money.
Thanks a lot, Alexia. I have to apologize because I unconsciously selected this recommendation now that I'm looking also at the links between them, because they somehow target this digital and all the connected divides that somehow are now at really a burning issue to discuss, even more with the pandemic. They're affecting, of course, not only health, but also education, for instance. So the second one that we will discuss more with Gisela is really closely connected to this. And it's more about literacy. I actually read, as you did, the fantastic news about Galicia championing innovation procurement in Spain. So they are doing an amazing job in fostering SMEs growth, etc. in this sector. But we still have this hot topic everywhere, I think, across Europe, because this the digital literacy and more broadly speaking, also health and data literacy probably is a matter that we really need to tackle if you don't want that this divide converts then into broader health inequalities and also socioeconomic inequalities in the end. So how is this addressed in Galicia, in your opinion, Gisela? And if you think that this is still a valid recommendation, it should be more granular, and how would do you think this entails in your territory?
Thanks, Valentina. I do think it's a strong recommendation. I would still put on there on the dashboard. Also because Alexia, you don't have to be jealous, because sometimes there's nothing perfect. The situation we have here, I wouldn't say it's a problem, but the challenge is that the healthcare system was very, very prone in being an actor into digitalization. We were very fast on that. The interoperability, the digital literacy of the care workers, professional care workers, formal care workers, was a process of 10 years, so it's not so easy. But then now what happens is, like, the Galician health cluster is like the star, but the rest of the society, which involve people that work in the Galician health cluster, I mean, involve people at the end of the day, and especially with COVID, has shown that digitalization as well as the digital literacy is necessary across society, because if not, you will have the silo of our sector. So now it's very difficult to actually make social care systems, because they also start digitalizing in their own way and reducing the papers, but it's carried out at the government level, while the Galician health cluster digitalization, it's really, really in-house. It's an in-house knowledge, it's an in-house system. So now we really have to manage these two systems to talk in favor of everybody being able to not only have equal treatment healthcare wise, but social care wise, and other issues like Alexia was mentioning, connectivity, mobility, everything. So at the end of the day, putting the people in the center is not so trivial, because if you digitalize only one sector and you only helping the use or this digital literacy on that sector and very, very specific, you leave out people, and then the inequalities may not be in health, but it may be in social care assistance or just normal life. And with COVID, everybody now is digitalized and working remotely, and then the simplest things to like make appointments, knowing where to go, all the different processes have been seen that it's not so easily clear, and the gap is there, not maybe in using a phone or using a technology, but I think it's important, as equally important, the digital literacy of the people, of how to use, how to operate within a digital world or tech world, but also the digital literacy of how the companies or how the technical and digital solutions should be adapted to the process itself that people do. And I think that is a key point, because if not to be so tech, if it's not useful,
if I may piggyback on that, Gisela, and reading also one of the last comments about the situation in Czechia, and the very low support of governments, then here again we realize how much bottom-up initiatives are like essential, and we are supporting an initiative that was literally just it came along before COVID. It was kind of a helping each other to use mobile phones and iPads or tablets and so on and so forth in that specific age group of the over 60s. And they brought it, so they've got a lot of voluntary helpers, starting from school kids to students to young retirees that are that are finished with their active life and are very techie and actually help those that are 5, 10, 15 years, 20 years older than they are. And they just received funding for 2 years, having that support and help. And what they're doing now, they're taking it to the next level, and in regard to the current lockdown and COVID situation, where at least in Germany shops are still closed. They and in order to encourage that local shopping, they are going to have the local shops on a platform, and at the same time they're helping people to use a tablet or a smartphone to buy online but locally. And so that's great, because it's ticking so many boxes. It's putting the people in it's connecting the people, it's assuring their independency, it's raising or increasing their digital literacy. So we love those projects, and we really support them as much as we can, because that's where that's where the music goes, right?
Yeah. I don't know if you have been following the chat, but we have 3 interventions, and we have Lenka raising her hand. So we have comments from Lenka, Kadi, and Liz. Lenka, do you want to address the yes. speakers or the room? Please feel free.
Thank you, Carina. I just want to react to Alexia, because of course there are similar bottom-up initiatives, and especially during the COVID period with these small e-shops and the community help. But what I meant with my comment was that sometimes there are some initiatives from the governmental level, but their impact is more or less negative, because then it appears that you have to use mandatory an application or some registration via website, and it's so user unfriendly that even for skilled users it might be a problem, because nobody asks the users what they think about it. It's not done with this good practice analysis and so on, no testing with users of all kinds and skills. And that is a problem, that even when you compare this local level with a very small or even zero budget, they are developing very useful applications and activities. You go to governmental level, they spend a lot of money and it's for nothing. So this is an issue. And I use this opportunity just to ask Valentina briefly if it is possible to join the CSA still, because I saw on your map that Czechia is not involved.
Oh, okay. So Czechia was not represented, yes, probably in the interview with stakeholders, and I'm really sorry for this. We have tried to use all our contacts to reach the highest number of countries. But of course, apart from the very basic participate button that there is in the website of the project, you can reach out to us and let us know modalities or possibilities for collaboration that we could find out together, because the project will last still for a while. And this is also part of the contribution that you are giving right now, because we will let's say keep this recommendation living for a while. This will be one of the workshops during which we'll be discussing those recommendations with the stakeholders, and we would like really to listen to you and also from learning from your suggestions about their validity. I'm just looking at the screen, and for instance now, and maybe with crossover program, we should not only refer to crossover between different type of literacy, but according to what Alexia was suggesting, maybe we should also emphasize that this program should be designed together with civil society organization and listening to them, because they know really what's happening in the on the ground and what could be the hurdles, so to avoid to design investment programs that are not in the end working as you were suggesting. So any kind of contribution will be still valid and appreciated. Thanks a lot.
Thank you. Excellent. I will check your website. Thank you.
Thank you. From the others, anyone else wants to join in, or do you prefer that we just try to address your comments in the chat? I have Liz, Kadi, and now Roxana, Milika.
I don't think I want to say anything. Thank you very much. Okay. I think it's very interesting, but no, thank you.
Okay. So mainly, if I see it, we have issues. Oh, Brian is joining in. Please come in, Brian.
Yeah, I just want to say that though I'm supposed to know all of these things, I was fascinated by and learned a lot just from the presentations. Sometimes, you know, we should take the time maybe to listen a bit more rather than just talking, as I said before. My reaction is that I think when you look at what Valentina was highlighting there, and we start to talk about it, my experience is that it is really difficult to talk the language that people understand. Because if you think about what we all talk about, because we're all in this sector, we talk in acronyms, we talk in shorthand. And many people, when we talk about reaching out to communities, have no clue, A, that we exist, really no understanding what governments do. And you may or may not agree, but this is my view and my experience. And one of the things I do is I'm involved in a couple of my own private companies. And one of the things we have learned is we try to do a community wellness project during COVID. And we learned a lot about that. And that was that it's all very well saying people should use their iPads. Well, you know, not everybody's got an iPad. Secondly, how do you do virtual visits? Do people really know what the government are offering them? Do the government really know what those people want from the government? Because again, I go back to this need and solutions point. I worry that the terminology is not always appropriate for the audience we're going after, I suppose I would sum up in saying. So as part of all these various projects we're all involved in, this is not a matter of dumbing down the words, but actually one of my duties in one of my other companies was to visit a lot of people in their own homes to understand what they needed as opposed to what the government were offering them. And they said, yeah, the government does all this, but I don't want any of that. I want this. You go back to the government, I won't tell you which country it was in, and they say, yeah, we don't do that. Why not? Well, we always do it this way. But you've got to change. Well, that takes a long time. And so there's this inertia, you know, oh, well, it's worked before. Well, has it worked? So I suppose I'd conclude by saying, I'm fascinated by this group that are together today and indeed across all of our ecosystems. And it is clear we have a responsibility as well as an opportunity to actually listen more to people. I think you get the communities by talking their language, and you do that perhaps through some of more better connections with local organizations, charities, people who reach out to communities already, and don't try to reinvent the wheel. Why don't we engage more with the third sector as well? So that's all I want to say. Fascinating discussions. Thank you.
Thank you, Brian. Yeah, you have the support of Louisa, who is saying it's a very true point. Also, Gisela was asking about, was mentioning about pharmacies network and regional policy, and I see that in the commentaries above. A lot of people have issues on going to funding and to the support of government. So Brian already answered a little bit to this, but do you feel, any of you, that there is any tips you can provide, or is just fostering communication that you think is needed? Well, this goes for any of you, sorry.
Yeah, Carina, the comment I was mentioning is that also not only money, but as Brian also was pointing out, you need to understand the people, and that you don't get it from one day to the other. I mean, COVID came and everybody was closed. So in the case of the region of Galicia, the pharmacies that are the ones that have the contact with the people, the rural pharmacy especially, and the national police was the one carrying the iPad. So during the COVID time, the old people, everybody, in fact, one of the few remaining entities open were the pharmacies, the hospital, of course, and the pharmacies could give this support in suddenly maybe, well, you may have to buy through an iPad, but at least you still talk with a person when you're trying to do the normal exercise that you used to use. And the police, for example, accompany them or show them how to do online banking, which was another thing. Like normally people used to go and withdraw cash, and now they couldn't do it, all folks. So I think building on trust and really pinpointing the stakeholders that have this connection is important.
Mm-hmm. Yeah, very good. Well, I think we are a little lagging already, a little bit long and over our time, but the discussion was very interesting, so I don't think anyone minded. But if there are any questions, please throw them now. Otherwise, I would pass the word to Willeke and close it. Okay, so thank you all for this discussion, and Willeke, the floor is yours.
Thank you, Carina, for organizing everything. And also thanks to Brian, Alexia, and Gabriela to present the nice initiatives that were there. As a farmer's daughter, I was very pleased to have this presentation because it was related to nature and to see all the things that Brian, you saw 10 years ago and what beautiful flowers grow out of this. And I'm very much looking forward to the rest, to see what can be harvested after then. So and I would like to thank also, because I learned a lot about what the actual thing is about cooperation, and especially the message from again from Brian. I'm sure you must be very inspirational. Is that we should listen more to each other, and I think that is very important indeed. There was one request if we share the PowerPoints afterwards. So I think that will be done, that we sent to everyone. So if the speakers will send it to me, then I'm very happy. And the next webinar is on the 18th of May at 11:30 Central European Time. And that will be about the certification of age-friendly housing, and also about the standardization of e-health. And it will be presented by Leiden. And Carina and I are working on a webinar about the Bauhaus, the new European Bauhaus initiative. So, but that's not no date yet, so that is to come. So thank you very much for your attention. And I hope to see you again next time. So please keep safe, and see you next time. Bye.
Thank you so much. Bye.
Thank you so much.
Thanks for
Bye.
having us.
Bye-bye.
Bye-bye.